and welcome this morning to Your Money, Your Life with Sherrill Braswell, and we have got some interesting things for you today. You know, we're going to talk about Medicare basics, and the basics of anything we think about, well, you know, the basics, we already know all that. Well, I guarantee you, when you hear it this morning, you know, you're going to say, oh, I didn't know that. Sometimes we just don't know the basics. Yeah. So anyway, we're going to talk about it this morning. So Sherrill, who's eligible for Medicare?
Yeah, good question. The basic eligibility on Medicare, people who are age 65 and older is your largest group of folks who are on Medicare. If you're under 65, you're eligible for Medicare if you have certain disabilities. One of the original disabilities for people under 65 was end-stage renal disease,
okay,
and ALS, what they call Lou Gehrig's disease.
Right.
Those were two of the original things that were listed, and then there are rules and regulations with every level.
Right.
I mean specifics, especially around if the person is under 65 and they're disabled. There are hoops you have to jump through, to qualify. One of the basic ones is that you have to be on disability for 24 months before you're eligible for Medicare.
Okay.
24 months and 1 day, you're eligible. So you've got that 2-year period of time where you're kind of on your own. And usually if people are disabled, they've got medical situations going on, so it's a little bit tough there during that period.
What would happen, and we're not getting political this morning with Sherrill. Sherrill don't do the politics, but what would happen if we had the Medicare for all? What would that do? I mean,
the devil's in the details.
Yes.
It depends on how it's being operated. I mean, I truly believe that for the most part, Medicare is a pretty well run operation.
Right.
I don't care what you're doing. There's going to be somebody who's going to try to figure out how to cheat the system.
Yes.
That's just life. And there is Medicare fraud that goes on.
But should we do away with our commercial insurances?
Well, see, I mean, think about this. People don't think about this, but Medicare, a huge part of it is the commercial insurance portion of it.
Yeah, well, it really is.
Because and we'll talk about this a little bit more.
Part.
The supplements.
Yeah.
And see, Medicare Advantage, that's all private.
Okay.
That's all private. People don't understand that, but yeah, it's properly organized and run. It could probably be a good thing.
Okay.
There's just so much room there for greed and corruption.
Oh yes. Oh, absolutely.
It really is. That'd be a tough one.
Yeah.
That would be a tough one. I mean, it would change the landscape of medicine, and
right.
Because for me personally, I mean, I feel like medicine has got to change. And I think I was reading an article last week, says 95% of the money we spend on medicine is reactive.
Right.
And where it needs to be is 95% needs to be spent on preventive.
Yes.
On the front end, and we don't do that.
Well, what scares me is doctors. I hear doctors saying all the time, "Oh, I don't take Medicare. I don't take Medicare patients."
Well, 97% of them do.
Really?
Yeah.
So most of them do.
Yes.
It's just that select few. Okay. Well, that's good to know, because I was thinking, okay, what is original Medicare?
When Medicare was originally founded, there was this is the beginning of the Medicare alphabet soup. Medicare A and B. Medicare A would pay for your hospital bills, and Medicare B was focused on paying for your doctor bills. So I tell folks, I said, think about it. Medicare A is the hospital, the big building, and then Medicare B is the doctor's office.
Okay.
And everything is kind of broken down into those two, primary categories on that. And the Part A, like I said, is the hospital. You're staying in the hospital, your inpatient care. The Part B is the doctor's visits and your outpatient care. Is the super simple breakdown on that.
Right.
Yeah.
So what Medicare options are available?
The two big decisions that you have to choose from when you're getting to that point, getting to the enrolling in Medicare, you've got to decide: am I going to do original Medicare, or am I going to do what's called Part C or Medicare Advantage?
Mm-hmm.
So if you go original Medicare, which is you'll enroll in Medicare A and B, you're going to get a supplement to go with that, a Medicare supplement. Your A and B basically covers 80% of your bills. And then the supplement comes in and takes care of just about all of the 20%.
Right.
And there are variations inside the Medicare supplement world. I'm knocking on 70 here in another month, and I've been in Medicare for 5 years,
right?
And I've had 5 different plans because I just wanted to check them out.
Well,
and understand how they work.
That's why they need to come and see you, Sherrill, because I think that's the biggest thing when you go on Medicare. Golly, what do I get?
Mm-hmm.
What plan do I need? Mm-hmm. What plan do I get? A, B, C. I mean, you got all these things, and you're thinking, Medicare Advantage. What fits me?
Yeah.
And you need to sit down with somebody and let them know your personal situation, because it's no cookie cutter.
No, it is not.
It's not cookie cutter.
No, it is not.
I mean, it depends on what you need and what your needs are. That's why you need to sit down with Sherrill. There's his number right there. But they need to sit down with you and just go over their life.
It is.
Yesterday,
the last 2 days, the last 2 days, excuse me, I've been texting and emailing back and forth between 2 or 3 different people that were just utterly convinced that they could change their plans anytime, anywhere, and you can and you can't. There are definite hard rules you have to stick with. And most people don't understand, because this person, who I think is an intelligent person, well, I read this in CMS, Center for Medicare and Medicaid Services. It says you can change any time. I said, you didn't read all of it.
Okay.
Because you cannot. There are many situations where you cannot change. There are ways you can change, but
you mean during a year,
right? And
but next year you can't.
Yes and no.
Oh, gosh.
I mean, we'll spend another day on that.
Yes,
I mean, we'll go into that detail because it is extremely confusing, and that's where some people have made huge mistakes, and it costs them thousands of dollars in medical expenses because they made the wrong choice and didn't understand what they had done. Yeah.
Okay, that is definitely for another day. We will definitely talk about that.
We can definitely go through that.
So what are some of the differences in Medicare supplements and Medicare Advantage?
Okay, Medicare supplements, so we have Medicare A and B. Okay. All right, that's paying for about 80% of your bill.
Okay.
So you get a Medicare supplement plan. When you're turning 65, you can sign up for Medicare supplement plan regardless of your health condition. At that point, there's no pre-existing condition situation. So you can sign up when you're 65 if you've got cancer. It makes no difference. You get the same price everybody else does. You get the same benefit everybody else does. So that takes care of a good portion of your out-of-pocket expenses if you have original Medicare. So there's a premium involved. There's a monthly premium involved, and then, depending on how you set your plan up, you may or may not have some small copays. And when I say small copays, I mean like $12, $15, $20, something like that.
Right.
The Medicare Advantage plans are what is called Part C of Medicare. This is also private insurance companies that provide Medicare Part A services and Medicare Part B services, and sometimes they also include prescriptions in that service. So this is a private company.
Well, why do they call it Medicare then?
I have my opinion. Probably shouldn't say what it is.
This is really
It's
I'm
you know,
learning.
Yeah, because I mean, when you sign up for Medicare Advantage, you're leaving Medicare. You know, you're
That
leaving
makes
Medicare,
sense.
and I'm you know, my opinion, the federal government wants you to do Medicare Advantage because it takes them to Medicare, it takes the federal government off the hook
Off the hook.
for
Yeah.
your Medicare services.
Okay.
And you know, I mean, y'all have heard me talk about it before. I'm not a huge fan. There are some instances where I think Medicare Advantage is a good thing. And probably 25% of my clientele have Medicare Advantage plans. You know, if I set somebody up on a Medicare Advantage plan for their, you know, the first time they're getting into one or turning 65, there are things that if they're going to work with me and have a Medicare Advantage plan, there's other things they're also going to have to make that plan be safe.
Is that United thing? United,
You about United Healthcare?
I guess.
I mean, that's
Is
one of
that
the
what
companies.
Medicare? That's one of the companies then.
Yes,
that,
and they, you know, United Healthcare has Medicare supplements. They have Medicare Advantage plans. You know.
Okay.
Yeah, I mean, Aetna has both. You know, Humana has both. I mean,
because
you know,
a lady told me one time we were talking about Medicare, and she said, "No, I have United." I said, "But you have Medicare too, right?" She said, "No." She said, "This is what I have."
Yeah, and most folks
and I was
don't
so
know what they got.
confused.
Yeah, and people don't. You know, it's hard to understand in a way,
Yes.
and most folks are like, okay, I got this card. This is what my card. I go in, I see the doctor. They say, hey, Mr. Jones, see you next time. You know, so they're not too big on getting into the details. You know,
Right,
on
right.
that.
So you're having an upcoming seminar. Will you be talking about some of these things in
Yes,
the
ma'am.
seminar?
Yes, ma'am. We're going to looking at Tuesday, October the 8th, and we'll be talking about this some more between now and then.
Yes.
Tuesday, October the 8th, and Tuesday, October the 15th at 6:30. It's going to be in the Technology Center out at Wesleyan.
Right here in our
Yeah.
building.
Yeah.
In our building, right across the hall.
And we're going to, you know, try to answer as many questions as we can. If we can't answer them there, you know, we'll have 2 or 3 of our folks out there with me that night, and they'll just get your questions, set up a time to talk to you, and get your answers, and get back to you.
You definitely want to come. You definitely
Yeah.
want to come to this. Do they need to sign up?
Yes, ma'am. Call our main office number. It's 252, here on the screen, 316-8166. And, you know, if we can't answer the phone right then, you know, please leave your name, your phone number, and that you're interested in the seminar. We'll call you back and set you up, you know, to get you enrolled, because we're not going to have enough seats, you know.
Yeah,
And-
people want to know about this.
Yeah, and we may end up
And it's time to
probably-
sign up again,
You're
isn't
right.
it? In
That's
October.
October 15th is the beginning of open enrollment.
Yes.
And you have until December the 7th, you know, to make your changes. And so we'll probably do more than these 2 during that period of time,
Right.
just to get to as many folks as we can on that.
Right. Absolutely. So you definitely want to come and learn all you can. I mean, Sherrill talks about this every other week on the morning show, but this is a more in-depth. It's a seminar, which gives you a chance to ask questions and things like that. So bring your questions with you and come at 6:30 on the 8th and the 15th, or if you can't make but one of them, that's fine too. And come on out and let Sherrill and his team talk to you all about it, because Medicare, for the everyday average person, it's complicated. It's complicated. So
It is.
anyway, well, thank you, Sherrill, for
Yes,
being
ma'am.
here this
Thank
morning.
you.
This was really good information. You know, every time you come, I learn something. So I certainly learned something this morning, and I know you did too. So you can call Sherrill at any time and set up an appointment. Make sure you set up, because Sherrill's going to be going around now out in the field. He'll be going around and to folks that can't get out or whatever. So make sure you don't just go by his office and he's not there. 316-8166. Tell him where you're located.
Yes, ma'am. 880 Country Club Road. We're at the intersection of Country Club and Hunter Hill. calling the business condominium, sitting on the corner there. And if you're looking at the front of the building, we're on the far right-hand end, very last unit on the end of the building.
Okay. Well, thank you, Sherrill, for being with us
Thank
this
you.
morning.
Enjoyed it.
All right, and we'll see you back in 2 weeks.
Mhm.
Okay, we'll be right back with you right after this.